A new home, a new life. So many things changing. Sights and sounds, new smells, strange food, complicated rules for living. Yet one thing remains the same: your love for your family. Mothers, sons, wives, and brothers. You want them all to be happy and healthy. We can help. Let us navigate this new world with you. Together, we can build healthier families and a healthier you. The healthcare system in the United States can be very complicated. New residents may be unsure where to go, what kind of care to ask for, and how much healthcare will cost. The U.S. healthcare system has 4 levels: primary care, secondary care, tertiary care, and community care. Community care helps prevent you from getting sick, and primary care is usually the first place to go when you do get sick. Primary care means the medical care you receive from a healthcare provider, like a doctor or a nurse when you are sick. Primary care will be provided at the doctor's office or at a clinic for things like a sore throat, a rash, a cough, a headache, or a pregnancy. Sometimes your healthcare provider will send you to another doctor who has more training or expertise in the health problem that you have. This is called secondary care. These specialists may be heart doctors, skin doctors, or cancer doctors. Some health insurance companies require you to go see your primary care doctor first and get a referral to a specialist. Other health insurance companies allow you to go straight to a specialist for secondary care without seeing your primary doctor first. The third level of care in the U.S. healthcare system is called tertiary care. This is usually extra special care for advanced medical problems like cancer management, heart surgery, brain surgery, or severe burn care. Finally, the fourth level of care is called community care. This includes healthcare services that are provided outside of a clinic. They may be provided by the health department or by a school nurse. Community care includes things like immunizations, water testing, or exercise programs. They are services that try to prevent you from getting sick. These services cost very little and are sometimes free. By using community care services, you can stay healthier and may not have to go to your primary care doctor as often. Sometimes people get so sick that they cannot wait for their primary care provider's office to open. In that case, they need to decide how quickly they need medical care. This will help them decide where to go. Many providers have a phone number a person can call after business hours to talk with a nurse. The nurse can help them decide where to go for care. If the health problem is not life-threatening but cannot wait until the doctor's office opens, an urgent care center may be the best choice. Urgent care centers are usually open in the evenings and on weekends. They can take care of most urgent medical needs. They don't cost as much as an emergency room, and the wait is usually shorter. If you have a medical problem that threatens your life, of course go to an emergency room immediately. Emergency rooms are for very serious health problems. They are open all night and all day. Don't ever try to drive yourself to the emergency room. Ask a friend to drive you there. You can also call 911 on your telephone and ask for an ambulance to take you to the emergency room. Just remember, ambulance rides are not free. Your ambulance ride and emergency room visit may be very expensive, but your life is worth far more. The cost of medical care can be different at every place you go. If you have health insurance, you may be expected to pay part of the bill, called a copayment. If you do not have insurance, you may be expected to pay all of the bill. Most large hospitals must provide you with medical care at the emergency room, even if you cannot pay for it. Use your best judgment about what kind of health care you need and how quickly you need it. Working together to build healthier families and a healthier you.